Hi, I'm Hannah, back with some hands-on training for caring for your loved one with Alzheimer's. Let's talk about the importance of medication management. When assisting your loved one with taking medication, it is important for everyone to understand what medication is being taken and why it is being taken. Developing a plan or timeline to ensure safe consumption of your medication for your loved one with Alzheimer's disease may be necessary to maintain their health and well-being. Some tips for effectively managing your loved one's medications include coordinating with all of your loved one's doctors and the pharmacist that fills their prescriptions. Make sure all healthcare professionals are aware of the medications that your loved one is taking, including vitamins or over-the-counter medications. This is important in order to ensure that there are no harmful drug interactions that may occur when multiple medications are taken. Also, make sure that all healthcare professionals are aware of any allergies to medications or side effects that have happened in the past. Keep a list of current medications handy for all of your loved one's medical appointments. Include the date that each medication was started as well. Educate yourself on all the medications that your loved one has been prescribed. This includes knowing the name, frequency, dosage, side effects, and purpose. Make the doctor aware if you notice your loved one having any side effects. Do not ever alter how much or how often they are taking a medication. Always consult a doctor first. Use a pillbox organizer. Keep a calendar or use a dry erase board to make sure that medication is taken according to the prescription. Create a daily routine for when certain medications should be taken, such as in the morning or at night, and with or without food. Consult a pharmacist with any questions. Prioritize the most important medications first. Be patient. It may take several attempts to get your loved one to take their medications. As the disease progresses, you will need to provide more care for your loved one regarding their medication routine. Some suggestions for doing so include using simple, clear language when providing instructions. Give the pills one at a time and explain what they are for. Sit next to them while they take them instead of standing over them. If they refuse, take a break and try again later. If you notice your loved one having difficulty swallowing, consult a doctor and see if the medicine is available in liquid form or if it is okay to crush and mix with food or for safe consumption. Make sure you keep your loved one's medications in a locked container or cabinet to avoid accidental overdoses. Throw out medications that have expired or ones that are no longer being taken. Keep the National Poison Control Center number and the address of the nearest emergency room close by. You may need to call 911 in the event of a medication emergency as well. We are going to be talking about medication management. And as your loved one progresses through the different stages of Alzheimer's, you'll notice that it'll get harder and harder to get them to sort of take their medications, and some days it'll be easier than others. This is a sort of a medication management or a medication record form. You can print these off online, and we'll include them in the resources we provide to you guys as well. This one's from aarp.org, and so basically it's just a big chart that lays out all of the medications your loved one's taking. So, for example, what they're taking, where is it, what's the form? Is it in a pill? Is it an injection, liquid, things like that? What's the dosage? How much and when? How often do you use it? Is it regular or occasionally? The start and stop dates. So when was it first prescribed? When do you stop taking it? And then any other notes or directions if they have any allergies or things like that. So for you as a caregiver, I think this is super important because it lays out everything they're taking, when they're taking it, and why. So again, these can be found online, and we'll kind of include those in the resources we provide you guys with. Also on the front sheet, it's just a general record, so personal information and things like that. Also, another strategy or technique to use is you can use a whiteboard or a dry erase board or a calendar. A big jumbo large print calendar is awesome for that because you can write down, okay, well, you have to take your medicine at this day and this time, things like that. A dry erase board, if their medications change every day or from hour to hour, you can have this dry erase board in front of them, and then they know, okay, it's time for me to take my medication at noon, or if they continue to ask those repetitive questions, they have that as a visual reminder in addition to the verbal reminders that you provide them with. So moving into that, this is, as I'm sure a lot of people have probably seen, a pill sorter or pill box or whatever you would like to call it. This one is smaller. You can get large ones that are organized by time, so you can get one that has the whole day, Monday, the pills you take in the morning, noon, and at night. This is just a more simpler one for daily medications. So you have to just base it upon your loved one's needs and how much medication they're taking. So it is important as your loved one continues to progress to be aware of some different strategies you can use when they are unwilling to take their medication. So you always want to remember to be on their level, or sit by them, whether they're on the bed, whether they're in a chair, sit next to them. You can provide like a gentle touch or just sort of comforting words if they're having trouble taking their medication. So after you are sitting by them and things like that, make sure they have something to drink, everything on hand. Pills are easily accessible. And so example scenario you can use is always play it back to the doctor. So if they're having trouble taking their medications, you can say something like, the doctor needs you to take your medication for high blood pressure. Here's your pill, and you can drink some water. And just keep it very simple. Don't go into the details of why or how. Just kind of keep it pretty simple and generic. And so that is pretty important, especially as they progress through Alzheimer's, because they're going to be confused and they're not going to know why they have to take all of these medications. So that is an important strategy to use. Or you can just simply say, here's your pill for high cholesterol. I need you to take this, put it in your mouth, and take a drink of water. So that's another scenario or another way you can phrase it, if that makes sense.